Coeliac disease, also spelled celiac disease, is an autoimmune disorder in which the immune system reacts abnormally to gluten, the protein found in wheat, barley, and rye. When people with celiac disease consume gluten, it triggers an immune response that damages a lining of the small intestine, specifically the villi, tiny finger-like projections that absorb nutrients. Over time, this damage can lead to malabsorption, nutritional deficiencies, and a range of symptoms. Causes and risk factors: celiac disease is primarily caused by an abnormal immune reaction to gluten. The exact reason why the immune system reacts this way is not fully understood, but it involves a combination of genetic and environmental factors. Genetic factors. Celiac disease has a strong genetic component. Most people with the condition have specific genetic markers called HLA-DQ2 or HLA-DQ8. However, having these genes doesn't guarantee the disease will develop, and many people with these markers never develop celiac disease. The family history of celiac disease increases the risk. First-degree relatives, parents, siblings, children of someone with celiac disease have a 10% chance of developing it. Environmental factors. The introduction of gluten-containing foods in infancy may influence the risk of developing celiac disease, although the timing of gluten introduction is no longer believed to be as critical as one thought. Certain infections or other environmental triggers can activate the immune response in genetically predisposed individuals. Other autoimmune diseases. People with other autoimmune conditions like type 1 diabetes, thyroid disease, or rheumatoid arthritis have a higher likelihood of developing celiac disease. Symptoms. The symptoms of celiac disease can vary widely, from mild to severe, and may affect the digestive system as well as other parts of the body. Some people may have no symptoms at all but still experience damage to the intestines. Digestive symptoms: diarrhea, chronic, foul-smelling, or pale stool, steatorrhea due to fat malabsorption, bloating and gas, a common symptom due to impaired digestion, abdominal pain and cramping, pain caused by inflammation and damage to the small intestine, nausea and vomiting. Some people experience frequent nausea. Constipation. Some individuals may alternate between diarrhea and constipation. Non-digestive symptoms: fatigue, often related to malnutrition, anemia, or the body's immune response. Weight loss. Unintentional weight loss due to poor nutrient absorption. Iron deficiency anemia, one of the most common complications of celiac disease, resulting from impaired absorption of iron in the damaged small intestine. Bone and joint pain. Malabsorption of calcium and vitamin D can lead to osteopenia or osteoporosis, weak bones and joint pain. Skin rash, dermatitis herpetiformis nichi, blistering rash that is a manifestation of celiac disease. This rash usually appears on the elbows, knees, scalp, and buttocks. Mouth ulcers, recurrent sores in the mouth. Neurological symptoms, including headaches, tingling or numbness in the hands and feet, peripheral neuropathy, balance issues, or brain fog, difficulty concentrating. Depression and anxiety. Mental health conditions can be exacerbated or triggered by celiac disease. Delayed growth or puberty in children. Malnutrition can lead to poor growth, delayed puberty, and short stature in children. Diagnosis: celiac disease can be challenging to diagnose because its symptoms can mimic those of other digestive disorders such as irritable bowel syndrome (IBS) or lactose intolerance. The diagnostic process typically includes blood tests, anti-tissue transglutaminase antibodies (TTGIGA). This is the most common and reliable test for diagnosing celiac disease. Anti-endometrial antibodies (EMA), another highly specific antibody test used for diagnosis. Total IgA level. This is done to ensure that the person doesn't have IgA deficiency, which could result in false negative antibody tests. Genetic testing. Genetic tests can determine if a person carries the HLA-DQ2 or HLA-DQ8 genes. However, since these genes are common in the general population, a positive result does not confirm the disease. A negative result can help rule it out, as almost all people with celiac disease have these genes. Endoscopy and biopsy. If blood tests are positive, the next step is usually an endoscopy, during which a doctor inserts a thin tube with a camera into the small intestine to take small tissue samples. Biopsy. The biopsy of the small intestine can show the light damage and confirm the diagnosis. In cases where the skin rash like dermatitis herpetiformis is present, the skin biopsy can diagnose celiac disease. Treatment. There is no cure for celiac disease, but it can be effectively managed with a strict gluten-free diet. This involves eliminating all foods containing gluten, which allows the small intestine to heal and symptoms to resolve. Gluten-free diet. Avoid gluten-containing grains. This includes wheat, barley, rye, and any derivatives of these grains. Gluten is found in many common foods, including bread, pasta, cereals, baked goods, and certain processed foods. Safe grains. Gluten-free grains include rice, corn, quinoa, buckwheat, millet, and amaranth. Hidden gluten. Gluten is often hidden in processed foods, sauces, soups, and certain medications, so careful reading of food labels is essential. Cross-contamination. Even small amounts of gluten can trigger symptoms and intestinal damage. Avoiding cross-contamination in shared kitchens or restaurants is critical. Dietary supplements. Many individuals with celiac disease may have deficiencies in vitamins and minerals, such as iron, calcium, vitamin D, vitamin B12, folate, and magnesium. Supplements may be necessary, especially in the early stages of recovery. Follow-up care. After diagnosis, regular follow-up appointments are needed to monitor recovery and ensure adherence to the gluten-free diet. Blood tests and sometimes repeat endoscopy may be performed to check if the intestines are healing. Complications. If left untreated, celiac disease can lead to serious complications due to chronic inflammation and malnutrition. Malabsorption. Long-term damage to the small intestine can lead to poor absorption of nutrients, causing vitamin and mineral deficiencies. Osteoporosis. Impaired calcium and vitamin D absorption can lead to weak bones and an increased risk of fractures. Infertility. Untreated celiac disease may contribute to infertility or recurrent miscarriages in women. Neurological disorders. peripheral neuropathy, ataxia, impaired coordination, and epilepsy are potential complications. Small bowel cancer and intestinal lymphoma. People with untreated celiac disease have a slightly higher risk of developing certain cancers, including small bowel adenocarcinoma and non-Hodgkin's lymphoma. Celiac disease versus gluten sensitivity. Some people experience symptoms similar to celiac disease when consuming gluten but do not have the same immune response or intestinal damage. This condition is known as non-celiac gluten sensitivity (NCGs). Unlike celiac disease, NCGs does not involve an autoimmune reaction, and there is no specific test for it. Diagnosis is made by ruling out celiac disease and wheat allergy. Living with celiac disease. Living with celiac disease requires lifelong adherence to a gluten-free diet. While this can be challenging, particularly in social settings or when dining out, education and support are crucial for managing the condition successfully. Education, learning to read labels carefully, understanding food sources of gluten, and finding reliable gluten-free brands is key. Support. Joining a celiac disease support group or working with a dietitian can help navigate the challenges of a gluten-free lifestyle. Prognosis. Most people with celiac disease can live healthy, symptom-free lives once they eliminate gluten from their diet. The intestinal damage usually heals over time, and symptoms improve. However, adhering strictly to a gluten-free diet is essential to avoid long-term complications. When to seek medical attention. Persistent digestive issues after consuming gluten-containing foods, unexplained weight loss, fatigue, or nutritional deficiencies despite a healthy diet, recurrent anemia or bone issues without an apparent cause. Family history of celiac disease with new onset of digestive symptoms. By following a strict gluten-free diet and managing their health proactively, most people with celiac disease can lead healthy, active lives free from the complications of the disorder.